Hundreds of thousands of San Diegans are now eligible to get the COVID vaccine if they're 75 years and older. But there's a big problem. There aren't hundreds of thousands of doses available. Good evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. Healthcare providers say that they have got their plans in place to get the vaccines out once they arrive. Our ABC 10 News reporter Adam Merkusen digs into where the vaccines are going, why there's not enough, and when more might arrive.
I was excited for getting it. I was looking forward to getting it.
David Flores is an emergency room nurse with UC San Diego Health. He's also one of the few people in California who's received both doses of the COVID-19 vaccine.
I really want this vaccine to be given to as many people who can take it as possible.
That's also the way Lynn Daniels feels. She got a shot earlier this week.
I asked the guy, I said, could I have a Snoopy Band-Aid or something? He said, well, I can give you an orange button that says I've had my COVID vaccine.
According to the state of California, more than 1.5 million doses have been administered. The state's COVID-19 vaccine website says so far the state's ordered 4.1 million doses. Of that, a little under 4 million doses have shipped to local health departments, health systems, and state agency entities. And that's very different from the nearly 40 million people that live here.
I join my colleagues in other jurisdictions in saying that whatever we have is simply not enough. We have built the infrastructure, we've built the partnerships, and we are ready to give vaccines to our community members.
Dr. Van Do Reynoso is Santa Barbara County's Director of Public Health. With counties across the state running out of vaccine doses and many not knowing when more are on the way, we asked her if she thinks the county's been allocated a fair number of doses.
We are consistent with a lot of other counties. There simply isn't enough vaccines.
So how do counties get doses? Health officials in San Diego County say doses are allocated based on population. While that's a factor, on Wednesday, California's Secretary of Health and Human Services described a process that's much more complex, using Tier 1A as an example. That's healthcare workers and long-term care residents.
Proportion in the state of those individuals in each county. So if you're a county that happens to have a regional hospital that draws from other counties, a bunch of the main health facilities there, an over-representation of skilled nursing facilities and other congregate care facilities, you might have seen a higher proportion of doses going to that county.
Dr. Galley says the complexities of the vaccine rollout are real, and there are other tools that the state uses. As far as when the state will get more, that's a process all in itself.
There's a whole process where we're told an allocation from the federal government to the state. We then share what the different counties are going to be receiving, and then they put in orders, and then those orders are sent to the CDC and then ultimately shipped later in the week.
Adam Merkusen, ABC 10 News.
And we have more information on the COVID vaccine, plus testing and resources available to you. You can go to 10news.com and click on the Rebound section.